Okay, shall I start now? Namaste everyone. Thank you so much for joining us today and welcome to the 17th webinar of Nepal Mental Health Research webinar series. The webinar series are being conducted by TPO Nepal in coordination with George Washington University, which focused on the capacity building of early and mid-career researchers. So before moving towards the webinar structures, to any of the webinar structures, I would like to introduce myself first and our team for this webinar. So I am Vinita Acharya. I am working as a research officer at TPO Nepal in RESEP project. And today I'll be moderating this webinar on behalf of our team. As regular, we have Ritika Singh, who is a research consultant at George Washington University. She will be handling the technical aspects of the webinar and also co-moderating the breakout sessions. Today, we also have Dr. Saugata Rai, who is a research scientist at George Washington University. He will be introducing our speaker later and also co-moderating our breakout sessions, as well as the question and answer sessions. So moving towards the webinar, as you can see in the screen, the title of our 17th webinar series, which is the Ethnographic Methodology in Global Mental Health, Reflections on an Ethnography of Psychosocial Interventions in Post-Earthquake Nepal. And our speaker is Dr. Liana Chase. We'll be introducing our speaker later. Before that, there are some couple of reminders or information that we share in every webinar. Okay. The very first reminder is that our webinar is being recorded. The main motive of recording this webinar is to save the recordings for later and share it with all the registered participants, as well as to share it in our social media pages, like in our Facebook, Twitter pages, as well as in the YouTube channel of our TPO Nepal. To remind you, we do share the webinar recordings in our social media pages, but we do not share the presentation slides or related articles which we have received from our speaker. So for that, you have to register the webinar. So if you haven't registered the webinar, we request you to fill out the registration form so that it will be easier for us to share the webinar material so that you can see it later and get back to us or speaker if you have any queries or suggestions as well. With all these, we ensure that we have permission for the recording as well. Talking about the webinar structures as the second reminder, as most of you have already known that the duration of this webinar is an hour, so it will run till 7 p.m. Nepali time, which is 6 to 7 p.m. And basically the structure of the webinar includes three main parts, where we have 12 to 15 minutes of presentations of our speaker, where we do not interrupt her. Instead, we let her complete her presentations related to her titles and content. After that, we have 10 to 15 minutes of question and answer sessions, where you can input any questions in the message box in between the presentation or in the question and answer sessions, which you have to ask to the speaker or discuss related to your confusions as well. After the question and answer sessions, we will be moving towards the breakout session, which will also be of 10 to 15 minutes. So the main motive of creating the breakout sessions is that we might feel comfortable in a smaller group to discuss more comfortably, and which would be more great as well. So in that, we create a smaller group of people. It depends on how much participants we have. So in that, we discuss on the discussions questions where our speaker has provided us. So we, our team, us and Dr. Liana will be co-moderating that breakout sessions. So we will be facilitating to you for the discussions as well. After that discussions, we will get back to the main room, and we as a co-moderator summarize the discussion in our respective group in a minute. So overall, the time of summary is 5 minutes. After that, we will wrap up the webinar. So for now, the last reminder is related to the feedback form, which we have developed, expecting the suggestions related to the webinar to make the webinar more better in upcoming futures, and to gain some kind of suggestions or advice related to the topics, mostly related to the mental and behavioral health research, which will be more beneficial for early and mid-career researchers. Yes, I have already mentioned, and adding to this, the main motive of this webinar is related to the capacity building of early and mid-career researchers. So if you have any suggestions or if you have any topic that you are interested in, you can put that in that feedback form so that we can review it and source same kind of topic for the webinar as well. So your feedback will be highly appreciated for the webinar to make it more better. So we will put the webinar and registration form in the message box as well. So more often we also send the feedback form with the materials also. So for the registration form, you can check our social media pages if you have missed this in the message box as well. So now relating to the events. So we are conducting the monthly webinar since July 2021 in the third week of every month. Invitation email will be sent out with the dates and speaker details to you. For more information, you can follow us to our social media pages, or if you have any queries, if you have missed our webinar, you can email us to our MHRN email address as well. So that's all related to the webinar. I think I have covered all the reminders as well. So for now, to introduce our speaker, I would like to request Soharda sir to introduce our speaker. So please.
Thank you, Vinita ji, and good evening, everyone. It's my great pleasure to introduce a dear friend of mine whose work I have been following and admiring for years, Dr. Liana Chase. Dr. Liana Chase is an assistant professor of anthropology at Durham University in the UK. She's a medical anthropologist whose research and teaching focus on global mental health, psychiatry, and care. Dr. Chase has a long-standing regional focus on the Nepal Himalaya, where she has been involved in anthropological research since 2008. Through most of this work, she was an affiliated researcher at TPU Nepal. Dr. Chase earned her BA in anthropology from Dartmouth College, US, and went on to spend a year working in the Bhutanese refugee camp of Eastern Nepal as a US Fulbright scholar. She then completed a master's in social and cultural psychiatry from McGill University, Canada, and her PhD in anthropology at SOAS, the School of Oriental and African Studies at University of London in 2019. Her work has been published in journals in anthropology and psychiatry, including Medicine Anthropology Theory and the Lancet Psychiatry. She is currently co-investigator on a 3-year ethnographic project entitled Transformation in Mental Health Care, an Anthropological Study of Open Dialogue in the UK's National Health Service. I should also mention that coincidentally last week here at the Center for Global Mental Health Equity at George Washington University, we had a journal club that was dedicated to one of your readings, and it was very interesting and engaging. I see some of the members of GW also here, and I look forward to hearing and discussing more about your work today. So over to you, Dr. Chase.
Thank you so much. Can you hear me all right? Yeah.
We can hear you.
Okay, let me just share my screen. And make it big. Is that okay for the presentation? Yeah. Okay, well, thank you so much. I just want to thank the organizers first off for having me, because I've been, and for all the work they're doing with this seminar series. I've been so enjoying coming to these presentations, and I've learned so much already. So it's really great to have a chance to sort of give something back to the series. म सम्भव भएसम्म नेपाली र इङ्ग्लिस मिसाएर बोल्छु आज, तर 3-4 वर्ष भयो नेपाली त्यति प्र्याक्टिस नगरेको, त्यही भएर माफ गर्नु होला. My Nepali is a bit rough. तर यदि मेरो कुरा स्पष्ट छैन भने मलाई रोक्नुस् अथवा हात समाउनुस्, अनि म अनुवाद गरिदिन सक्छु. So the I guess motivation behind this talk today is that as a medical anthropologist, my main methodological approach is ethnography. And I have a really strong conviction that there's a lot of untapped potential in this methodology for the field of global mental health that we're all a part of. So my hope for today is really just to kickstart a conversation with all of you about what this methodology could offer in the work that we're doing around mental health, and to hear how it might be relevant in your own practice, to reflect together on some of the strengths and limitations of the approach. But to do that, I'll start by just sharing an example of an ethnographic project project that I did in Nepal. And I'm really just going to briefly highlight two key findings that came out of that research, which I think I couldn't have learned using any other method. So I'll talk very briefly about sort of the context of the research. This was my PhD research, and it was in the post-earthquake context, Bhukampa Pastat Sandarbhama. And as all of you, I'm sure, are aware, this was the time when there was a lot of investment in mental health and psychosocial services, and there was a lot of hope that the earthquake could provide a chance to build back better, that you could sustainably scale up services across parts of the country where there hadn't been any kind of mental health care previously. So I came to this context of post-earthquake scaling up, having read a lot of critiques of exactly this kind of intervention. So I'm a critical medical anthropologist, very concerned with the workings of power through healthcare. I had read a lot of critiques about cultural, mismatch and inappropriateness of these kinds of programs, but also a lot of critiques of the way these programs can cause harm inadvertently. For example, by causing people to understand their own suffering in a very medical way and undermining, other kinds of approaches, dhami chakri, support from family and friends. So my research question was, my aspiration was basically to follow the social impacts of these interventions in real time over a period of 14 months from 2016 to 2017. And my question was, how are these interventions, mental health and psychosocial interventions, changing the way that people in rural Nepal seek and provide care for mental distress? So my methodology, as I mentioned, was ethnography. And for anyone who's not familiar, the sort of core feature, the distinguishing feature of ethnography is that we try to make ourselves a part of whatever it is we want to understand, whatever social context we want to understand. And the rationale behind that, from my perspective, is that there are some social phenomena that are just so complex. You can't understand them by just looking at what people say, especially when you're interviewing strangers who you've never met before. There's some phenomena that we can only understand from the inside perspective by immersing ourselves in them, by building, being part of the relationships, the sets of relations that we want to understand. So हामी दैनिक जीवनमा भाग लिन्छौं in whatever community we're trying to understand. It could be an ethnic group, it could be a village, it could be a community of professionals or experts. So in my situation, I spent 7 months trying to be part of the Nepali mental health and psychosocial care sector, mainly in Kathmandu. So I went to lots of trainings. Basically, I just said yes to any invitation I got. I spent a lot of time with experts, in their various fields. I became a trainer myself. So that's another aspect of ethnography. We're not trying to observe things from an outside perspective. We're really trying to develop that emic or insider perspective. So I became involved in everything I was studying. I helped develop curricula for mental health trainings, traveled around the country with other trainers. So that was the first 7 months of my research. And then the second 7 months, Pahari Chetrama, and I lived with a family there, a Tamang family, for 7 months. And my focus there was on an intervention being rolled out that trained Moila Sahakari Sadesyaharu like Talim Di, Mano Manosamajik Sahayog Sambandit. And I was trying to spend a lot of time with the women who received that training, as well as the families, the people in families who were using their psychosocial support. So in all those contexts, I was taking loads and loads of field notes. This is a picture of me in my favorite field note-taking spot in the evening. Because what we're doing as ethnographers is developing a really subjective, rich subjective account of reality, we also need to practice reflexivity. So awareness of the limitations of our own perspective and what kinds of conclusions we can and can't draw given those limitations. And we also try to supplement our own perspective with the voices of others. So through interviews. So I did 55 semi-structured interviews with a range of different stakeholders in these interventions. So just to briefly touch on two things that I learned doing this research. The first one was about some of the challenges that these women psychosocial care providers faced so to providing care in their own neighborhood. So all of the women I worked with, so that was counselors with 6 months training, CPSWs with 1 week, 10 days training, community psychosocial workers, and FCHVs, who had 1 week of psychosocial training. All of them lived in the same neighborhood where they were providing psychosocial support, and they had relationships with their clients outside of the psychosocial care context. So they had business relationships, sometimes they were extended family members, sometimes they were just neighbors, they knew each other as neighbors. And in the global mental health literature, this is framed as a really positive thing because we call it community workers, those sort of frontline psychosocial care providers. Community workers understand सांस्कृतिक सन्दर्भ बुझ्नुहुन्छ. They understand how people express their emotions, how people, idioms of distress, we would say. They understand the social determinants of mental distress in that context. So there's a lot of positives, but what I found spending time there was that there's also sometimes challenges associated with trying to do psychosocial care work in your own community, in your own neighborhood. And one of the main challenges is that sometimes these community workers would break from the guidelines, the sort of formal psychosocial approach, and they would slip into much more everyday ways of relating to their clients. So everyday ways of giving care. And the main one that I became just fascinated by was convincing, which I'm translating from samjaunu, bujaunu, samjai bujai garnu, sometimes sarsalaha dinu, sujab dinu. So I became really fascinated by, this idea of convincing and what it offered that counseling didn't. So a lot of times in this village, people use counseling and convincing interchangeably. So they would sort of say, the counselor is the person you go see if you need to get convinced about, about something. But I think that the counseling and convincing are actually quite different. I think they are rooted in really different ideas about what constitutes good care, what the point of giving care is. So you could say different logics of care. It's just a fancy anthropological way of saying that. So I think, as Vitsi Toll and others have pointed out, counseling emphasizes individual autonomy. So one of the goals of counseling is to help someone become independent again. And so for that reason, as a counselor, your goal, you're not meant to pass judgment or give advice. Your goal is to facilitate someone being able to pursue their own goals, whatever they think is best for them at that time. In convincing, by contrast, from what I understood, convincing is based on the idea that somebody who's really distressed doesn't know what's best for them. They need guidance, they need help from others. They can't necessarily see what the right way forward is. And so a lot of times in practices of convincing that I observed, people were drawing on social and moral norms to guide someone about the right way to respond to distress. And rather than emphasizing an individual's independence, a lot of times they were emphasizing that person's responsibilities or their accountabilities to others, what they owe to their family, what they owe to society. And the outcome of some of that advice was really to repair social relationships. So to encourage someone to act in a way that would improve their social relationships, that would improve their their moral standing or their izat within their community. And some of the women I worked with were actually really critical of interventions that didn't do this, So they would say, what's the point of just giving medicine and emotional support if that person, starts to recover and they're completely alienated from their social environment, they're a social outcast. That's not really recovery. So I think this idea of convincing, we need to take it really seriously. We can't just dismiss it and say, this is bad practice, stick to the guidelines. I think we need to think about how these things can be complementary. But there are also times when counseling and convincing, I think, seem to contradict each other. For one of the kind of key examples of that is when the advice that that's being given, or the social and moral norms that the convincer is drawing on, are linked with stigma or with social inequality, some of the kind of key determinants of mental distress and mental illness. So just to give a brief example of that, underwater Gori. And so I asked her, she had received a week of training, and I asked her, how have you used this training? How have you used, your psychosocial skills? And she gave udaharan dinu bhayo, jasma ekjana chimekiko buhari wako gharma aunu bhayo. And that buhari sasusanga samasya bhaireko थियो, त्यो बुहारीले आत्महत्याको बारेमा सोच्न थालेको थियो. So she had started to feel suicidal. And त्यो FCHV कसरी counseling गर्नुभयो भने, she told the woman, the buhari, you shouldn't say that kind of thing. Yस्तो कुरा भन्नु हुँदैन. You have to not treat small things like big things. सहन गर्न सक्नुपर्छ. So she basically was convincing the woman in a way that I think goes directly against the ideas of counseling, right? And I think it's a really good example of how sometimes, when you're using this sort of social, moral, normative framework in convincing, you can actually be perpetuating some of the root causes of suffering. So in this case, gendered norms around what a buhari should and shouldn't say, should and shouldn't do, and also stigma related to expressing suicidality and difficult emotions. So this is a really complex task that we're giving these frontline psychosocial workers. And I think we have to think about the way that their embeddedness within their neighborhoods can be both a strength and a challenge at times. A second finding, which I'll mention just very briefly, had to do with issues of pay. So pay for these frontline psychosocial care providers. This is not something I had any plan to study coming in. I have no interest in economics. I don't understand maths at all. This wasn't my area. But the women I was working with very quickly pointed out that if I want to understand the impact of this intervention, it's really important to look at issues of pay and working conditions. So the women in this program were not paid. They were given a motivational incentive. And they were intended to volunteer their time as psychosocial care providers. And the rationale I was told for that from that the government stakeholders in the program put forward was that because this is a women's cooperative, these women are part of women's groups, it should be their contribution to society. So they should be ready to work for less so that this program can be scaled up around the country. So basically, they should be willing to volunteer to bridge that mental health treatment gap. And this is very, very common rationale behind lots of community health worker programs. Feminists have critiqued it very widely for a lot of different reasons. But program managers will also say, it helps for that woman's social status, their ijat, if they do community service, social service, volunteer work in their community. But what I found is that seems very obvious to me, but not all women are able to benefit from that sort of social capital that comes from doing volunteer work. And in particular, women from more marginalized backgrounds, might find that the costs of this way of working vastly outweigh the benefits. So as I said, I was living with a counselor who's Tamang, Janajati. Her family were subsistence farmers and they raised animals. That was sort of their main financial lifeline. And you counselor Tinbari gas Pario. She had so much work, so much burden of work. She was a young Buhari in the family. And because she didn't receive any incentive, the family salary, the family was not willing to sell any of their animals. They didn't feel financially secure selling their animals. So essentially she ended up doing two jobs, counseling and farm work. And it was caused her a lot of stress. She started to say, like, malai pani tension bhaireheko cha, tauko dukyo, kana man nalagne. Like, she just started to feel really stressed out, and it was unsustainable ultimately. So with a group of wonderful colleagues, some of whom are here right now, which is amazing to see, we ended up writing an article about this, advocating for the importance of good working conditions to make sure that global mental health research and interventions reduce rather than reproduce inequalities that actually lie at the core of, I think, some of the mental health inequities we're trying to tackle in our field. And we also argued for the importance of an intersectional feminist perspective. So thinking about how women from different sort of caste, ethnic backgrounds, different socioeconomic groups might experience interventions differently, rather than making assumptions about what Nepali women want. So just to offer some closing reflections before we go to a conversation, I think these examples capture what I see as some of the strengths of this methodology. So the fact that it's open-ended and iterative, so we respond to what's in front of us. We don't go to the field with a predetermined idea of what matters. We let the people who we work with guide us in terms of, what's important to pay attention to. I think capturing complex change through time. So if I had just gone to this village and interviewed the counselor, in month 1 of her work, she was so enthusiastic, I would have had a completely different view of this program than if I stayed there through that 7 months of time. And also likewise, if I didn't have a very strong relationship with that counselor, I think I wouldn't have gotten a very good picture, an honest picture of what was really happening. So yeah, and I think it sort of speaks for itself, the importance of understanding interventions, within their sociocultural and political economic context, rather than, outside, removed from that. Limitations, I think, are also really clear here. So depth over breadth. I know a lot about what happened to that particular counselor. I know very little about what happened to all the other counselors in the program, although Prabhati Shrestha, who's here, and I are trying to address that gap now together. The social positioning of the researcher, as I mentioned, can be a really important limitation. And I think we have to think especially critically about this when the researcher is a white foreigner. So as a kind of Bideshi white American doing research in Nepal, there are a lot of limitations to my perspective. Even when my Nepali was much better than it is now, I was never the level of a native speaker. I was always missing things. And a lot of things that slip through the cracks, I'm sure. And similarly, culturally, without having that kind of long-term cultural immersion, I'm sure I missed a lot of nuance, misunderstood things. Power is a really important thing to talk about in, I think, our sort of current global political economic context. If you're a white American researcher working in Nepal, you have really disproportionately privileged access to resources like scholarships, things like that. And that inequality, I think, really warps your experience. I think it shapes every engagement you have, or a lot of the engagements you have with people, and makes it really difficult at times, I think, to have a really authentic connection and a sense of, what reality is really like for people. So I would see that as an important limitation to keep in mind. All that said, I think there's still value in doing work outside of your own cultural context. I think that comparative perspective can be really enriching. So I think, all stories matter, all stories can be helpful, however limited their perspective may be. But I think the problem right now is that there isn't space for all stories. So there's not, ethnography is really resource intensive. It takes a lot of, you need to have access to scholarships and funding and support to be able to do this kind of work. And you also need to have platforms and audiences for that work. And I think the way in the unequal world we're living in now, not everybody has access to those resources. So you end up with, I'd say, many, many white American and European stories about Nepal, and not nearly enough, Nepali stories about Nepal told through the medium of ethnography and about the rest of the world. So that kind of structural inequality in who gets to do ethnography is something that I've been thinking a lot about recently. And that's all for me. I just wanted to put up thank you to my amazing research assistants and colleagues at TPO and everyone else. It's really wonderful to see so many of you here today. Thank you.
It's great. Thank you so much, Dr. Liana. So everyone, if you have any queries, you can input it in the message box, or you can raise your hand with the help of Zoom app. So, and I would like to request Sawarda sir to co-moderate the question and answer sessions.
Thanks, Vinitaji, and thanks, Liana, once again for such an interesting, honest, and a very deep conversation. I feel as a global mental health practitioner myself, your work and then all the reflections and things that we shared today gives us a different perspective on how we work and then help us to reflect and improve on things that we're doing right now. So thank you for putting that up there. I have a lot of questions, but I'm going to start off with the participant here in the webinar. And then I have the first question from Renu Sakir, is asking if you could speak a little bit more on the power aspect in terms of research and scholarship availability as a Bidesi researchers, and also would really love to hear from your heart, mind.
Yeah, it's a really wonderful question. I mean, my sense is that you all probably have a better idea of what that relationship does to interactions during fieldwork. But my sense was that, I mean, with a lot of the people I interacted with, there were a lot of other kinds of motivations for engaging with me. So people maybe had hope of access to resources. And this isn't, I'm not speaking about colleagues, I'm speaking more sort of working in a rural community up in the mountains, but hope that I would be able to sort of facilitate scholarships, or, you know, that I had connections to people, you know, with money that, so I think those kinds of just economic inequalities shaped every interaction I had in a way. You know, the idea that I was from a wealthy country, a developed country, and sometimes that would lead to sort of requests for help. Sometimes it would lead people, I think, to be very deferential, so to sort of, you know, overly respectful, not necessarily more honest, which is important. But other times people were really critical of that too. So some people were really openly critical about the sort of systems of inequality that I was disproportionately benefiting from. And that made some people reluctant to engage with me. You know, the fact that I was working related with an NGO made some people really reluctant to engage with me because they felt like, you know, I was just sort of coming to their village and benefiting, you know, from the work I was doing, and they wouldn't see any benefit. Which is a really valid critique. You know, we as researchers, we are benefiting from the work we're doing, oftentimes to a greater degree than the people who are contributing their time. So yeah, I mean, these are sort of just my guesses, my impressions of how that sort of, those global power dynamics came to bear on my sort of field relationships. But I think you all probably also have a better sense of how Bideshis are seen in Nepal and how that might change or shape interactions.
Thanks, Liana. We have more question. So the second question is from Benitaji, who asks, how would you like to share your difficulty? How difficult it was for you to cope with the perspective of Nepali society towards mental health? And can I add like a following question on that? Can you share more about during the times, like just after the disaster, since you worked at that time? Sure.
Yeah, so I mean, I was there about a year after the earthquake. Yeah, so there were a lot of challenges in terms of housing and things like that. Everyone was still living in a temporary shelter. And there was a lot of grief. I was working in particular with one family that was really grief-stricken. So that was actually quite difficult to cope with, just personally, emotionally. In terms of the perspective of Nepali society toward mental health, I don't know if cope is the word that I would use. I think there there were some parts that I found difficult, like around stigmatization of particularly women, certain groups of women who I think really didn't get a lot of social support or emotional support. And I found that quite difficult, especially having close relationships with those women. But also that's not new to me. I think, I come from a family with a lot of mental health struggles, and there's a lot of stigma as well in the US and in the UK where I work now, where people really experience being a social outcast. So it wasn't necessarily novel. I think, does that answer your question? Is that what you meant by coping with the perspective of Nepali society?
I mean, does it answer? All right. Okay, so let's go to, just for the sake of time, let's go to another question from Kripa, who's asking, if someone beside a Videshi, a Nepali researcher, goes to do ethnography, how is it going to be different? Like, is it going to take less amount of time? Kripa has put up the numbers, 3 months rather than the 7 months that you took.
That's a really good point. So right now I'm working with Prabhati Shrestha, who I think is here, and 2 Nepali anthropology graduate students, and we're doing work on the same program, and they're going out to stay with counselors. And I've been absolutely amazed by how much they learn in just one week, staying with a counselor. So yeah, I do think there is maybe some, if you already are really familiar with the language and the cultural context, there's a sort of efficiency maybe that comes with that. But on the other hand, I think, even if you're from the same, so right now I'm working in the UK, so I'm working in my native language. I have UK British ancestry, very familiar cultural context. And I did 16 months of ethnography for this current project. And it felt really important, even though I wasn't struggling with some of those language culture barriers, felt really important to sort of capture change through time. So I think even if, you struggle less with kind of comprehension and grasping what's going on, there's still some value in doing that long-term immersive work, because that's how you capture, I think sometimes what's most of interest to ethnographers is the change, is that sort of dynamic flow of things. So I think there's still quite a bit of value. I think probably maybe a Nepali ethnographer would see things that I wouldn't see, and I would maybe see things that a Nepali ethnographer wouldn't see, because I'm viewing things through a comparative lens. So it would be a very different story, very different story, but very, very valuable, I think.
Sure. Thanks, Liana. I'm not an ethnographer, but my experience doing work in other places that I have been to, like in Chitwan or in Jumla, this reminded me of how reflective we need to be as a native ethnographer or a native researchers as well, because I feel that when we're doing this, there are a lot of chances of our internalized biases or things that we have heard from before, right? So for someone like you going to a new place and then learning all of the concepts as new, I think that's something different than for someone, a Nepali, who goes to a place that I have heard so much about, and then there are some things that are attached to that particular place, particular person, and you need to get over that and then start like new. So I feel that's what's necessary as well. That's my experience. All right, thank you. So do we have any more questions? So if you have any more questions, okay, I have a hand raised by Pratibhaji Khanal Prativa. So you can just unmute yourself and ask the question.
Okay, hello. Thank you for a wonderful presentation. Actually, I'm interested. I'm currently doing a research mixed method study. So I was wondering, it is basically for all the qualitative study. Whenever we collect the data, we go into an emotional component or the emotional aspect of the participants. But I wonder, where do we keep all those, the emotional component? Because I have never seen someone citing it or never seen them in the verbatim of the participants. So can you please put a light on it? since you are more, I consider you as an expert in the field of qualitative study. So
So you mean, where do you put the participants' emotions or your own emotions?
No, the participants' emotions, because when we create a verbatim, because when we collect or when we are writing the field notes, we do put their smile, cryings, and all the emotional aspects also goes hand in hand. But whenever we formulate a verbatim, or when we keep the sub-theme component, I think I am afraid to say that I have never seen that component in the verbatim, especially the participants' verbatim. So my query is that.
Yeah, it's a really good question. I think you've actually just said one of the key benefits of ethnography as opposed to just qualitative health research. So in ethnography, you're not just capturing what people say, you're capturing the whole encounter. So if you read some articles by ethnographers, oftentimes, they don't just quote people, they'll give the whole context of that exchange. Where were you sitting? When did the person begin to cry? How were you feeling at that time? So in my view, this is one of the beautiful things about ethnography, is that it's a full body. You're using your full body, your intuition, your emotions, your senses, to make sense of reality. So you're not just looking at the verbal, you're not limited to the verbal. You can include all of that as data, all of that is informing your analysis. So I think in ethnography, I think you're right, in qualitative health research, that doesn't get captured a lot of times. It slips through the cracks. And ethnography is a way that we can sort of tell richer stories, because we can talk about what people say, but also how they were feeling, how, what they were doing, and how you felt at the time, and sort of contextualize the verbal. So yeah, I would really encourage you to think about including some ethnographic methods.
Thank you.
Thank you both. We have more questions on the way, and I had a couple of questions, but because of the sake of time, we need to stop the question and answer round. But Liana, if you are fine, then I would also ask the participant to contact you directly if they have other questions that can be answered within this time frame. Is that fine with you?
Yeah, absolutely.
All right, so with this, I'm going to hand it over to Ritika, who is going to take us all to different breakout rooms and then do all the discussion.
Thanks, Soharda. Just to let everybody know, we have 4 breakout rooms. We've tried to group people we know to be very comfortable in English in one breakout room with you, Liana. So I hope that facilitates the process. The rest of us will be divided in 3 different groups. The breakout room will continue for 10 minutes, after which you will be prompted to be redirected towards the main room. I hope everybody enjoys the breakout sessions. I'm opening the rooms now. Thank you. Nine, 6, 9, 9.
बोल्दा बोल्दै टाइम सक्यो डिस्कस गरेरै सकिएन सो टाइम वेस्ट
same.
नगरिकन समराइज गरौँ है सो क्वेसन नम्बर 1 कसले डिस्कस गर्नुभएको थियो यु क्यान गो फर्स्ट
Liana.
That was
Okay.
our group. So yeah, we had some really interesting experiences shared of doing ethnography actually in an emergency room setting around screening for suicidality, and yeah, how valuable that was. How, you know, without that sort of ethnographic perspective, the understanding of that clinical context would have been really completely different. So that was really encouraging to hear that this is already happening in different clinical spaces in Nepal. We talked about how psychiatrists might sort of draw in more of an ethnographic perspective into their clinical work, as well as getting involved in ethnography. And we talked about, from Justi's perspective, some of the challenges that psychiatrists have in actually trying to adopt a different perspective and sort of break out of that like really narrow clinical gaze, how difficult that can be to do. So yeah, it was a really rich conversation.
Okay, so मेरो चाहिँ क्वेसन नम्बर 2 मा चाहिँ व्हाट आर सम अब्स्ट्याकल्स यु सी टु टेक त्यो चाहिँ एथनोग्राफिक एप्रोचलाई कसरी ग्लोबल मेन्टल हेल्थ वर्कमा लैजान अब्स्ट्याकल्स कस्तो हुन्छ भन्ने थियो सो यसमा चाहिँ एकदम मिक्स्ड इन्फर्मेसन र एउटै भएकोले गर्दा म डाइरेक्टली पोइन्टमै भन्छु जस्तो यो एथनोग्राफिक एप्रोच भनेको हामीले सिधै प्रि डिटरमाइन नगरिकिन वही फिल्डमै गएर गर्ने कुरा हुन्छ जसमा चाहिँ कोही रिसर्चरको पर्सपेक्टिभ अथवा त्यो कन्टेक्स्ट कस्तो छ पोस्ट ट्रमेटिकको कुराहरू गर्ने बेलामा चाहिँ जस्तो रिसर्चरले उसले आफूले कसरी लिइरहेको छ त्यो कन्टेक्स्टलाई बाउन्ड्रिज कसरी सेट गर्छ अथवा उसको रोल डिस्ट्रिब्युसन कस्तो छ र उसले कुनै कम्युनिटी अब कुनै नेसनल इन्टरनेसनल भए पनि जस्तो ग्लोबल साउथमा कसरी बुझिन्छ त्यो कन्टेक्स्टलाई लिएर र यता आएर कसरी बुझिन्छ भनेर रिसर्चरको बायस र गर्ने कम्युनिटीमा बुझाउन सकेन कल्चरली डिफ्रेन्ट कन्टेक्स्टमा भने चाहिँ त्यसले गर्दा अब्स्ट्याकल्स हुन सक्छ सो अरु भनेको चाहिँ जस्तो लङ टाइमले गर्दा कसैलाई बुझाउन अथवा केही गर्न लङ टाइम गर्दा अथवा सेन्सिटिभ कुराहरुमा चाहिँ रिसर्च गर्दा डिफरेन्सेसले गर्दा इन्टरप्रिटेसन बायस पनि हुन सक्छ भन्ने कुरा आयो यो यतिकै कनेक्टेड छ त्यही भएर मैले यति भने सो Thank you.
Okay, so question 3 मा चाहिँ म गइहाल्छु हामीले पनि एक्चुअली ओभरअल एथनोग्राफिक अप्रोच ग्लोबल मेन्टल हेल्थमा अब्स्टिकल्सहरु के हुन्छ भनेर डिस्कसन गर्यौं तर हाम्रो डिस्कसन चाहिँ मुभ्ड अन टु एथनोग्राफिक मात्र हैन ओभरअल रिसर्च गर्नु नै कतिको डिफिकल्टीज हुन्छ भनेर अनि अ कपल अफ थिंग्स दैट केम अप वाज जुन हामीले प्रेजेन्टेसनमा पनि कुरा गरेको थियौं व्हेन पीपल आर जो काउन्सलर्सहरु रिसर्चर्सहरु कम्युनिटीमा बस्नुहुन्छ इट इज भेरी डिफिकल्ट फर देम आफ्टर अ व्हाइल टु बी टेकन सिरियसली उहाँहरुको आफ्नै कम्युनिटीमा र उहाँहरु अरु कम्युनिटीमा जानु भयो भने चाहिँ बरु उहाँलाई सिरियसली एज एन आउटसाइडर लिन्छ भन्ने एउटा कुरा आयो अर्को एउटा कुरा चाहिँ के पनि आयो भन्दाखेरि नेपाल एज अ होल एग्रिकल्चरल सोसाइटी र धेरै ठाउँ चाहिँ लोवर सोसियो इकोनोमिक स्टेटसले डिफाइन भएको कारणले चाहिँ नि एभ्रीबडीको प्राइमरी प्रायोरिटी इज उहाँहरुको इकोनोमिक स्टेटस सो त्यो भन्दा बियोन्ड चाहिँ मान्छेहरु धेरै जानै खोज्नुहुन्न उहाँहरु एकदम पैसाको अभाव समस्याहरुको कुरा गर्नुहुन्छ डिपर डिग गर्नु चाहिँ त्यति रेडी हुनुहुन्न अनि नेपालमै पनि विभिन्न भाषाहरु भएको कारणले गर्दाखेरि नेपाली नै युज गर्दाखेरि पनि कम्प्लेक्सिटीजहरु आउने नेपाली बुझ्ने मान्छेले पनि साथसाथै नेपाली नबुझ्ने मान्छेहरु भएको कारणले पनि कम्प्लेक्सिटीजहरु आउने अनि हाम्रो एकजना एथनोग्राफीमै काम गर्नु भएको साथीले चाहिँ नि मेन्टल हेल्थको जुन कन्सेप्चुअलाइजेसन छ सोसाइटीमा त्यसले पनि स्टिग्माले गर्दाखेरि किनभने उहाँको एउटा एक्सपिरियन्समा चाहिँ पागलको बारे पढ्नु आएको पागल भन्ने जुन एउटा नेगेटिभ स्टिग्मासँग एसोसिएटेड कन्सेप्ट चाहिँ उहाँहरुले धेरै फेस गर्नु भएको छ भन्ने पनि आयो यसो कुराले गर्दाखेरि चाहिँ देयर इज अ लट अफ obstacles in working in mental health in Nepal.
म फोर्थ क्वेसनमा गइहाल्छु है त फोर्थ क्वेसन चाहिँ हाम्रो के थियो भन्दाले चाहिँ आइडियाज रिगार्डिङ हाउ डु वी प्रमोट इक्विटेबल रिप्रेजेन्टेसन अफ डाइभर्स भोइसेस एन्ड पर्सपेक्टिभ इन ग्लोबल मेन्टल हेल्थ रिसर्च भन्ने कुराहरू भएको थियो हाम्रो पनि धेरै इन्ट्रेस्टिङ कुराहरू भयो अनि फर्स्ट चाहिँ हामीले रिप्रेजेन्टेसनको बारेमा कुरा गऱ्यौँ इन टर्म्स अफ जियोग्राफी इन टर्म्स अफ एथनिसिटी अथवा उनीहरूको आफ्नो लिभड एक्सपिरियन्स maybe with mental illness or mental illness हुन्छ नि के भन्छ डिसेबिलिटी भन्नेको कुराहरुमा अनि त्यसपछि सेकेन्डमा चाहिँ हामीले धेरै चाहिँ मेथोडोलोजीको बारेमा कुरा गर्यौं सो हाउ डु वी चेन्ज आवर or how do we amend our methodology भन्ने कुराहरुमा किनभने right now I say a lot of things are happening from an ethic perspective, so need something more from an emic perspective as well. अनि यसमा हामीले कुरा गर्दाखेरि चाहिँ we talked about things like who is designing the research questions, just the end users हरूले button नै आएको हो कि is it something that is being done by let's say the other researchers or who are the funders, and it is including more diverse people within our research context, and not only for them to be a subject of the research, but for them being researchers as well. Like for example, one of our participants talked about Nepalma धेरै care practices so about including people like faith healers are all to be part of the research conversation and all. And again, looking at the perspective, just one of our participants was talking about Liana-le देखाउनु भएको कुरामा पनि जुन चाहिँ कुरा आएको थियो, it was coming from a female perspective, right? So when we think about care, we think more, it comes from a female perspective as well. So त्यो कुराहरुमा पनि we need to be careful, and त्यसले गर्दाखेरि you can get more diverse voices भन्ने थियो. So यति नै हाम्रो ग्रुपबाट चाहिँ. Yes.
Okay, so it's almost 7. So I'd like to thank everyone for your interactive participations in the webinar. And I'd like to thank Dr. Liana for sharing such an amazing work. It's really great. We are really grateful to have you in this webinar. And thank you so much, Ritika ma'am, Sawarda sir, for your support and being a great mentors. Thank you so much, everyone. See you in the next webinar. Please registration form for the materials, and see you next month. Thank you.
Thank you, Vinita ji, for your awesome moderation.
Thank you.
Thank you. Bye-bye.
Bye-bye.
Liana. Thank you so much. Thank you.
Bye-bye. Thank you so much, everyone.
Bye-bye.
Bye.